Hello and welcome to Aging Matters. This is a program that is provided by and supported by the Berks County Area Agency on Aging. My name is Ann Barlet and I'm the Public Advocacy and Outreach Manager for the agency. Our show this evening is on shingles, and I have a wonderful guest with me, Maripatricia Welz-Bosna. A long name there, Mary Pat, I'm going to call you, yep. Who is a nurse practitioner with the Pain Management Center at Reading Hospital. So thank you and welcome,
Sure.
Mary Pat.
Thanks for
having me. We have a
again.
lot to talk about tonight. I think I'm glad we decided to do this show. We talked before about what else could we do, and I think that shingles is something that you kind of hear about, and then it kind of dies and then it comes back, and so it kind of does this, and we're never sure, really, should I worry about it, shouldn't I, what is it? You know, you hear people talk about some of the symptoms they have. So I thought it would be great to focus on, first of all, you know, we're going to start with what is shingles and how do you get it, and what maybe if we're at risk for it and how and why, and then of course how do we treat it, and again, the prevention. So let's start right in with what is shingles?
It's a virus.
Okay.
Yeah. And it's the chickenpox virus, really. It's varicella, varicella zoster in particular, and all of us who are of a certain age have probably had the chickenpox up until 1995 when the chickenpox vaccine came about. So that's kind of put a little bit of a different spin on it. So you develop the chickenpox, you get over it, and that virus just kind of, they call it a ghost virus. It kind of just harbors in our nerves. And researchers, physicians and stuff, they have some idea what will kind of make it come about again, but they really don't know.
So something maybe triggers it, to kind of
certain triggers and stuff like that, for it then to develop as the herpes zoster virus, which is shingles. So it's a chickenpox virus that then kind of hides and hibernates and then reinvents itself as the herpes zoster virus.
Okay.
Yeah.
So I guess that's where we want to go. What is this where we're going to talk maybe those triggers? What causes?
Also, what it's kind of a weird phenomenon because now we have developed the chickenpox virus. So that came about in 1995. So you have a lot of 31, 40-year-old people that have never had the chickenpox, and it's kind of now even presenting itself as this weird event where when you are exposed to the virus and get the chickenpox, your natural immunity kind of builds up. They're starting to find that this age group really has the immunity but not as strong. And then, like, for me, myself, I had the chickenpox, but my son never had the chickenpox. My mother had the chickenpox. I had the chickenpox. My brothers and sisters had the chickenpox. So therefore, every time we develop the chickenpox, she being around us, it kind of builds up your immunity even more. So they're now kind of finding that people within that 31, 40, 42 that have gotten the vaccine and then their children have never developed chickenpox because they've gotten the vaccine, they might be a little bit more prone to developing shingles. So that's just one. So yeah, it's kind of, and it's all, you know, viruses are quirky little animals.
And probably as we talk, affecting us a little bit different, a little bit the same, and probably the experiences with it are a little different potentially. Okay. So if we look at, I believe that you had a slide that you wanted to show about what causes.
So we have the basics.
Yes. Down. It should be just the down arrow. There you go.
So what causes shingles? We've kind of gone through that. You can see on the slide the nerve fiber is actually where it kind of hides and, you know, the ghost, and that's where it's going to come out. The next thing is who's at risk.
Yes.
And primarily any people over the age of 60 are at higher risk. they're about half of the population that develop shingles. 1 in 3 Americans will develop shingles. Over 1 million Americans a year develop shingles. But the primary focus is on those that are immunosuppressed, and that's a large variable. You have
Give me an example of some
patients as simple as diabetes can make you immunosuppressed. Patients that, or not patients, I should say people that take steroids on a regular, everyday basis for a chronic illness.
Okay.
Steroids naturally suppress your immune system and make you more susceptible to illness. Patients that are people that have cancer and are on chemotherapeutic agents that will suppress your immune system. So those patients are, or those people are more prone to colds, or if you're receiving chemo, that sort of thing. You want to stay away from people who are ill or sick, so because of the immune system being down. People that have one of the cancers is like leukemia, because of the suppression of your cells, that sort of thing. So, and now they're finding it's not just necessarily older adults, but it can be in younger adults too.
Well, that's what I was going to ask you when you said 60 and older, and we all use that number for a variety of different things. And I was going to guess if it was also because the likelihood of potentially having more of a disease or condition, chronic condition, either causing that suppression of the immune system, or is it also because of the age? Typically, we may have had also more chronic conditions.
Yeah, exactly. They also think, although they're not sure, that prolonged stress. So someone who is undergoing a really traumatic, stressful event and they're under stress for 3 to 6 months, can kind of lower your immune system also. But also, like we were talking about, I can remember specifically my nephew, who's I think 31, 32 now. He was a senior in college, or no, not a senior in college, a senior in high school, and was at football camp and developed shingles during the summer. So younger adults can develop it too. He was healthy, and what spurred it, you just don't know. And that's what a lot of providers and people in the field say. We think these are some of the issues, but we don't exactly know.
There's probably been some commonalities when you're looking at folks that happened, but
there's non-specific.
All righty. So you talked a little bit about the types of folks that were who were at risk, whether they were a certain age with chronic conditions, whether they've been exposed, whether it's been the immunosuppressant situation. So then you said to, of course, giving the example of the nephew going to that camp. So then is it logical, again, trying to figure it out, is that you kind of say, well, then was that contagious? What was the environment? That he was among other people. So is it contagious by, is it similar to a cough, a cold where I'm coughing and then I'm going, hey, and they're, whacking each other and around each other? Is it? So tell us.
Well,
do we know that?
That's kind of a yes and no. We were going to talk about that in a couple more slides. But yes, it is contagious, and no, it's not contagious.
Okay.
So, is shingles itself contagious? No.
Okay.
But if someone has shingles and you have never had the chickenpox, yes, it's contagious. So it's kind of like this yes or no sort of thing. So more than likely, with my nephew who was younger, it was probably, it was extremely hot. I remember it was in the summer. He was at a football camp every single day, outside, depleted, probably hydration, that sort of thing. Also probably depleted physically, like really pushing himself, that sort of thing. And maybe under a little bit of stress, I don't know. So why and was someone else there at that camp? I don't know. But he, for whatever reason, at that point, his system was prone. He was a little bit immunosuppressed. But no, it is yes and it is no contagious. When you develop, and we'll go through one of the slides, what some of the symptoms are, and when a person first gets it, that's when it's most contagious with the blisters.
Okay, all righty. So we talked a little bit about the risk factors, contagious. Is there anything else about that? I guess we should really go into then. I'd like to stay with him because it sounds like a good story. So he's at camp. Do you think he starts feeling funny, or did he get home? Is there like a time frame after you're kind of exposed to that? Is there a time frame that you might then develop some symptoms, and or maybe it starts but you don't realize it because of the common type of symptom could be associated with something else, and then so give us a little bit about some of the symptoms, and then again a time frame if it to know, oh, I was exposed to that X amount of time ago.
I think with him being younger, it wasn't a first thought of my, sister-in-law and brother. Most people develop what they develop a weird sensation in their skin. So what you have to recall, or what you have to remember with shingles, is it follows what we call a dermatome. And a dermatome is a nerve that is under our skin.
So we saw in that first slide, as I recall, you had that big, thicker looking nerve that was going in under our skin. Okay,
so we have them, if you want to think about our spinal cord kind of as a tree trunk, and off of the tree trunk you have two sides of nerve endings that are kind of coming down. Cervical, thoracic, and our lumbar. So most people, so the virus usually is along one of those nerve endings. And most people say they start feeling a weird kind of crawling sensation. A lot of people will start experiencing like itching on the skin, and sometimes burning, but nothing is there yet. And usually within the next day or so, they will start to show a rash. They can have a fever. They can feel general malaise. So a lot of people might think they just are maybe getting a flu.
Well, thinking, oh, you're around people, and if somebody again has a cold and you're passing it around, you might think that.
And it's not until the rash develops that's when it's kind of like, aha.
A little different.
The rash will come out 1 to 2 days, and then what happens is along that band-like nerve ending, you're going to start developing blisters. And
always? That's always? Okay.
And that's kind of like the telltale sign. When you see the blisters, you know you have. And with shingles, it's only on one side of the body. It's unilateral. It does not cross.
So it kind of just picks the one side of the column of the
So if you have your spinal cord and you're let's say at T8 and it's going around here, you're going to have like a band kind of around in this area, but it's not going to be on the other side. It won't cross that spinal column. So it's usually on one side, rash first, pain, itching, and then the blisters come out. And that's when someone can be most they can infect someone who hasn't had the chicken pox, because those vesicles contain a really high level of virus, the varicose. So if
I would imagine you wouldn't want to. You would want to be very careful, and of course, medical
and even if you've had the chicken,
and touch it, pop it.
Exactly. And when these patients come into the hospital, or these people coming into the hospital, we're wearing gloves and everything. So even at home too, even if you have had the chicken pox, you still want to use precaution. Women who are pregnant, that sort of thing, keep them away. And then people who are immunosuppressed, keep them away. That kind of, and that'll last for about a week, 3 to 5 days, maybe 7, and then those vesicles kind of start to dry out, and a person will get kind of crusting over that, and that's when they're not contagious any longer, or you shouldn't, be, you still need to be cautious, but they're not as contagious. And that'll last anywhere from another week to 3 weeks. The total virus is about 4 weeks.
I wanted to show I think you have a slide to show us what it looks like.
And this
it helps us to see what I should be looking for. you know, should I start that beginning of, you know, that tingling and that itching and maybe the burning and then start to see that? So this is a typical
This would be
rash.
probably a thoracic,
Okay.
meaning starting in the middle and just kind of going across. Thoracic is the most common. Cervical, yes, but primarily the thoracic, so like the middle of the trunk kind of thing. Trigeminal or face.
I was going to say, I've heard people, and even I've heard them
you
say something
have
about
to
the
be
eye.
really, really careful. So trigeminal, face, and kind of like the forehead.
And would it necessarily be both places or either or? Like, in other words, would I have it here and
they can,
here?
but it's primarily in one area. But they can run because that would be two separate dermatomes or two separate nerve roots. If it is in the face or anywhere near the eye, you really need to get to a physician quickly. The treatment will go through as an antiviral, and you want to get on that. But I've had a lot of patients or a lot of people that have had it close to the eye, and we've actually sent them to like an ophthalmologist because you want to not have it get into the eye. It can get into the eye, and then you have to be careful for any kind of vision issues and stuff like that. But yeah.
And I would imagine, again, how dramatic for somebody also with another chronic condition. Who's, you mentioned earlier about diabetics and diabetes, and that in itself can affect vision.
And diabetes, people that have diabetes don't heal as fast as other people. Or any other patient who's on, or any other person that's immunosuppressed are not healing as quickly or as fast. So
All right. So clearly then a segue into, once I start seeing, you know, this rash that we're showing, or even before, if I'm not sure, I start to see that, I really want to seek medical treatment. I don't want to
your
just
doctor.
wait and say, well, she told me that it would do this, and then it would, you know, have those and then bubble over, and then we would crust over and we would go away. I don't want to wait through that whole process. I want to seek treatment because also it is very painful, is it not? Because I would, you know, they were talking about the nerve endings and whatnot, and then so that produces pain with it, right?
A lot of people have pain with it, and the pain is for, well, twofold. You want to get treatment as quickly as possible because though the treatment will make the virus hopefully minimize it. It's similar to, you know how when we have the flu now, and if you get into your provider quickly, you can have Tamiflu. The Tamiflu isn't getting rid of your flu, but hopefully it's eliminating maybe a day or two, making it not as severe. And treatment for shingles is similar. So you want to get in and start the treatment because the treatment can hopefully prevent it from being as long, and it can minimize the symptoms. And minimizing the symptoms is hopefully decreasing some of the pain. And for some people, once the virus is gone and the shingles have healed, they still have pain. So you want to get the medication or the antiviral in, or medications, because you hopefully want to not morph into a chronic pain issue or postherpetic neuralgia, which a lot of people do kind of morph into after having shingles. But with the shingles, yes, they have this burning kind of sensation, because what it is, think about, is a nerve ending that is swollen, flared up, and angry. And that hurts, and it's sharp, and it's shooting, and it can be a nagging, really, really uncomfortable pain.
All right, good. All righty. So, talked about the symptoms, the pain, and anything else you want to stay with at all in terms of the treatment?
Well, treatment, the standard course is an antiviral. So there's 3 antivirals. There's Zorvirax, Valtrex, and Famvar. Those are the 3 antivirals. You have to have it prescribed by your
oral.
Yes. Prescribed by your physician. As we said earlier, it's not going to take the shingles virus away. You're still going to have to go through its course, but hopefully it'll minimize some of the symptoms and then minimize some of the pain. Along with that, if you're having a lot of pain, some of the standard medications that we'll put patients on are gabapentin or Neurontin, which a lot of people take for nerve pain. And so if you think of this as a virus that has flared in a nerve ending that is making this nerve kind of fire and swell and kind of act angry and is sharp and shooting, that's what the gabapentin or Neurontin does. It specifically helps pain dealing with nerves. One of the other medications that's a spin-off of that is Lyrica, and I'm sure people have seen that on TV.
Yes.
Yeah, all the time on TV. So those two medications can be started along with the antiviral. So the antiviral is helping the virus, this is helping the pain. Later on, people take Tylenol, some ibuprofen, and then later afterwards, once the blisters and stuff have healed, you cannot use any of the products until that's happened. But they have capsaicin cream now, they have lidoderm cream, those sort of things to put over top of it. But it has to all be healed. It can't be still an open wound. And some of these, some people really develop an icky kind of, it can be icky for a little while.
All right, I'm going to hold that thought. We have a home viewer.
Oh, okay.
So,
I didn't know we did.
Welcome, home viewer, and what is your comment or question?
I have a question. I never had chicken pox, and I'm wondering, is there any possibility whatever of getting the disease if you did not have chicken pox?
Well, yes, you can develop chicken pox, and actually what they recommend is you need to talk to your provider, your doctor, and discuss with him whether you should get the chicken pox vaccine at your age now or the shingles vaccine.
I see.
Yeah.
I was tempted to get the shingles vaccine as a preventative. As I said, I've never had chicken pox.
Right.
But
I would check with your doctor first.
I didn't, and it was a question.
What's that?
I said I did, and I didn't get a positive answer.
Oh, you didn't get an answer. Oh. No. Well, what you need to know is if you're around anyone with shingles, you definitely are at high risk of developing chicken pox.
Oh, really?
Oh, yes. Yes. So if you are...
The bottom line is get the vaccine.
Yes, I think so.
Okay, I'm on my way.
Thanks for calling.
Much. Thank you.
You're welcome.
Bye-bye.
Oh, that's funny.
All righty. So moving along, we're going to have a few minutes yet to talk about, I guess we're looking at the prevention. Yes.
So the vaccine is called the Zostavax vaccine, developed in 2006, like the gentleman was just asking about, Denise. He was cute. So what the vaccine does is it can reduce the chances of developing shingles if you've had chickenpox. So someone like myself, if I've had chickenpox and stuff, and actually I did. I was in my primary care physician's office a few months ago. I'm in my mid-50s, but you see the advertisements on TV and stuff like that. I work in a hospital, and I asked her, I said, should I be getting this? And she said, no, not until you're 60 years old. And she said, even then we'll discuss it.
Does it wear off? I mean,
no, it doesn't wear off.
So would you need to get it again if you got it at 59, let's say?
Yeah, I know.
And do I need to get it at 83?
That I don't know, truly. That much I really don't know. But when you get the vaccine, it reduces the chances of developing shingles, and then it reduces the chances if you do develop. It doesn't mean you can't get the shingles.
Okay, all right.
You can still get the shingles even if you had the vaccine, but they say it minimizes the time frame and the severity of the shingles if you've had the vaccine.
And I'm going to stay with that because I wanted to ask also, you hear people, so although when you had the shingles and you got the treatment and kind of the rash, I guess, and that kind of went away, can it flare back up? Can it come back? It stays still within you.
You
it's still can
dormant.
Get it a little bit later, and we didn't talk about what triggers that. We're not really sure, but it can come back again.
And primarily people, again, immunosuppression is the biggest thing. Yeah.
And they talk about, I think some people talk, you mentioned like the stress factors or something that there's something that may
triggers.
bring it back out or trigger it. Is that okay? And typically come back in the same spot, same
Well,
place,
you may have it at a different spot.
Okay.
Yeah. Yeah. And they also say the best preventative is diet, exercise, and remaining healthy. You know, keeping our immune system, sleep, good sleep, that sort of thing. But keeping our immune system healthy so that we can fight these viruses is the best thing that you can do too.
Okay. So again, I would assume if, you know, they said, again, another age of being 60 and older in considering getting the vaccine.
Right. The other thing is, though, you also, it's very important to talk to your provider, because a lot of people that are immunosuppressed, let's say if you are a cancer patient, you're getting chemotherapy, or you are on prednisone, that sort of thing, it is actually advised not to get the vaccine. So you really do have to talk to your provider first. But a lot of people, if you are suppressed, you really shouldn't be getting the vaccine. It's similar to if you get the, if you're sick, they tell you not to go and get your flu shot. So it's the same principle.
Okay.
So you really do, even, I'm not sure the case with the gentleman they called, but you really need to talk to your provider about. Now I do know that a lot of these vaccines, you can walk into like a CVS and that sort of thing.
Can I just, is it available all the time?
It is. But I still think if a person has a primary care physician that knows them, knows what if they have any underlying medical comorbidities and stuff like that, I think it's best to check first.
All right. Yeah. But knowing that, check first as the physician, knowing that they may have it and could give it to you there.
Oh, yeah.
Or again, you said it was more common than I realized that they have it available at some of the drugstores.
Right.
And I know we don't have time, but I'm hoping we could talk about costs. I don't have statistics on costs. So in the 1 minute we have, any quick last-minute kind of thoughts, tips for us to know or to remember or to do, or where can we call to get more information?
Well, it's you can CDC online kind of thing. It's they have plain, simple facts for adults, Americans to read, that sort of thing. They kind of spell it out. I think understand that if you have never had the chicken pox, you probably need to, as I said to that gentleman, if you're ever exposed to anyone with shingles, you need to go to your provider and say, hey, my friend that I was just with last night playing cards with came down with shingles 2 days ago. I've never had the chicken pox. And in that case, it's going to be a wait and see and watch kind of thing. Anyone who's pregnant needs to stay if they're exposed to anybody. And just keeping healthy, diet,